Let us first start with gallbladder. We'll go step by step. When we speak about cholelithiasis or cholecystitis, when is surgery an indication? And what are the different, symptoms of this disease? And, can it be controlled by medically or should we go for surgery?
So far the gallstone disease is concerned, the worldwide consensus about the gallstone or the gallbladder polyps or the cholecystitis is the gold standard treatment is laparoscopic removal of the gallbladder, which we called as laparoscopic cholecystectomy. Previously there were two school of thoughts. The one school of thought was saying like this: if the stones are asymptomatic, just you need to avoid fatty, spicy and oily foods. And there was medicine trial as well with the name of some medicines, ursodeoxycholic acid and the deoxycholic acids. But then the consensus was made that it is associated with some complications that at times can be life-threatening. By saying this, I mean to say this stone from the gallbladder can slip and it can block the main liver duct, which we call as common bile duct. So if it blocks the common bile duct, then the patient presents with severe pain in the upper abdomen. He can present with the yellow discoloration of the sclera, dark color urine, then change in the stool color, clay colored stool, then pleuritis, generalized itching. So these symptoms, we guess that this is having obstructive jaundice or surgical jaundice. So one of the complications. Second complication that one can have if it slips from the gallbladder, that it can block the common door. Which common door? Where the liver and the pancreas meets and they open into the second part of the small intestine. So when it blocks that door, it gives rise to the pancreatitis as well, which is more dangerous in comparison with the obstructive jaundice. In that scenario, we cannot operate this patient. Like regarding the pancreatitis, I can talk about 2 hours about the pancreatitis, but one Indian author has summarized it beautifully.
What did he say?
He says, it stings like a scorpion, which means it produces severe unbearable pain. It drinks like a fish, which means it causes severe dehydration. It burrows like the rodents, which means it causes the abnormal communication. It eats like wolf, it causes necrosis of the pancreas. And it kills like a leopard, it is a life-threatening disease.
And we
because
don't even take
gallbladder stones, they are associated with the life-threatening complications. So even if this is incidental finding, nowadays the consensus is one should be discarding this bomb which has no time when and how this is going to explode.
So then we go for a cholecystectomy. So when we say that we're going for a cholecystectomy, people are scared that once the gallbladder is taken out, I don't know what their life will be normal or not. So how does their life change? What is the precaution or management they need to take after a cholecystectomy? And also, how long does a cholecystectomy take now and how long is the recovery rate?
There are facts, there are theories, and then there are myths existing in our society that without gallbladder you cannot eat these things for rest of your life. Without gallbladder you are going to get fatty, which is never in actual practice. I mean, the commonest surgery I just mentioned is the gallbladder removal surgery. Some people, they are born with absent gallbladder. So cholecystectomy in safe, expert hands is a very smooth procedure. Is a complication-free procedure. In a straightforward cases, it takes about 30 to 40 minutes.
That's it?
Yes.
And you're out?
And the second day, you resume your routine activities. It is so simple.
So that is very good. Everybody around here who is listening to the program or watching it should know that if somebody is suffering from these symptoms, instead of going that other route, they need to go immediately for a cholecystectomy and not worry about it.
I want to mention here, don't listen to the people who are not concerned about.
The doctor. Just listen to them.
Listen to your surgeon.
Exactly.
I mean, I have 15 years of experience. I am saying because I have operated about 4,000 to 5,000 gallbladders. So you live absolutely normal life after the surgery.
Oh.